Abu Yusuf's first question about someone who is in ICU and they put him on ventilator and they put him on continuous dialysis and maybe a pump for the heart to work. So, and they're charging money and the patient is 99% deceased. Well, this is not for your and my estimation. This is for the estimation and the verdict of trustworthy, and I underline trustworthy, doctors. What they have as do not resuscitate, DNR, which some patients acquire or ask for, this can be implemented if the trustworthy doctors said that this patient is like a vegetable. He's in a vegetated state. His brain cells are over with. No way he can be revived or return his consciousness because he is dead. But he remains alive because of the machines and the devices that we hook into him. In this case, yes, such a person can be terminated because he's actually dead. But if someone is alive, conscious, he can speak, but without the ventilator, he dies. We can never take this off him. For example, this Superman, Christopher Reeves, when he had his accident and he broke his neck while riding a horse, he was rushed into hospital. Once he broke his neck, his spinal cord was torn and cut. All the functions of his body failed. So they had to put something for his lungs, for his heart, and he was trained for like 6 months to be able to work with the machine and have the ability to breathe and control it. If they took off the machines, he would have certainly died. But he's a human being, he's alive, and he needs assistance. In this case, we cannot take the machines off of a patient who's in that category. So I hope this answers your question.